Hi, everyone. Welcome to Pathfinder Live. I'm Anissa Dean, and I'm a charitable giving advisor for Pathfinder. Thank you all so much for joining us virtually. Before I introduce our speakers, I want to let you know that we will expect this session to last about 30 minutes, including Q&A, which will be answered after the discussion. So feel free to use the chat function to send them our way, and we'll do our best to get to as many as we can. So I'm here with Pathfinder's Executive Director of Global Affairs, Crystal Lander, and Alyssa Patmos, who is a member of our Acacia Circle. They will be discussing the biggest risks to reproductive health and rights around the world right now, what we're seeing on the ground in the countries we serve, and how Pathfinder is adapting and continuing our critical work in the face of COVID-19. Alyssa is one of those amazingly impressive millennials who found her footing by quadrupling sales for startups with her curated brand and messaging strategies. She now helps women bet on themselves by designing businesses they love. And in between this and her work as an NLP certified coach, she is a very active member of our Acacia Circle, which is an active community of the next generation of philanthropists and advocates who support Pathfinder's mission. Alyssa is going to be in conversation today with Crystal Lander, who joined Pathfinder in July and serves as our Director of Global Affairs. Crystal has worked in global health for over 2 decades and has experience with managing organizational global health engagement in the US and 30 countries. Here at Pathfinder, Crystal is leading the strategy, design, and delivery of our advocacy campaigns, and she serves as an ambassador for Pathfinder around the world. She has already made quite an impact here by ramping up our advocacy work, which includes efforts to promote sexual and reproductive health and rights, both internationally and here in the US. I feel like I sound like a broken record since I've probably told her this numerous times, but I am really excited to have her on board. Not only because she's a delight to work with, but also because the fight for women's reproductive health is still that, a fight. And we need people like Crystal, Alyssa, and all of you to help us. With that, I will turn it over to Alyssa so that we can start the conversation.
Thank you. And thanks everyone for being here. Crystal, I want to kick this off with, when it comes to COVID, we talk about health at large, and we've heard a lot about it, but can you tell us what's happening around access to reproductive health, specifically due to COVID right now?
Thanks, Alyssa, and thanks for Pathfinder for hosting this live. What's really scary, I mean, we know COVID, even in the United States, was very scary and frightening, and all of a sudden everyone's at home, and you may have not, you thought about your immediate issues, right? You know, going to school or going to work, but for many women around the world, it really was a real lockdown. And that lockdown and access to reproductive health was a scary thing, because in low resource settings, you know, women going into a health clinic no longer is available. They may have been pregnant, they may have needed their follow-up care from a pregnancy, they just needed a well woman exam. All these things weren't happening anymore. So when we're talking about that access to reproductive health care, we're really talking about that frontline work. That primary health care all of a sudden was shut down. And so if you're talking about a week, you know, a couple of days or a week, it's like one thing. But when you're talking about months and months on end, it really becomes a scary factor. And you know, it really, for vulnerable populations of women and girls and children, this really became something a little bit scarier. It really became an issue of access and quality of care, not to mention the basics things that are missing, the supply chain, getting, you know, trucks to deliver things to primary healthcare clinics, or so that the services could continue. So it was a lot of disruptions, both directly in the homes, but also in the system for reproductive healthcare, which a lot of us equate with basic birth control. All of a sudden it was no longer available.
So what has that meant in areas where Pathfinder has a presence? Where has that left people?
Yeah, I mean, like everyone else. So the cool thing about our Pathfinder programs and our work in the 17 countries is that those countries are led by local nationals. And so this is, you know, they had to adjust for their own lives, but they also were able to quickly say, okay, what do we need to do? And how can we be a part of the solution? So programs that we were implementing, you know, all of those paused right away, but they had to like turn their hats around and say, okay, now as someone who wants to improve, what's happening and make sure we're talking to the right people. Pathfinder staff were amazing. They just jumped into action, started helping with ministries, helping with the policies, getting some things put in place, because I think, like the rest of the world, it was a little bit of a shock just for a couple of days and a couple of weeks of figuring out what's happening and what does this mean.
So can you elaborate a little bit on some of the similarities and some of the differences of how this is being experienced for people? You mentioned a few things in the beginning, but I think anytime we can connect to the human experience of what's really going on, and Pathfinder has such direct access, can you give us some examples?
Yeah. So we talked about a little bit about the economic piece. So jobs. Well, particularly in low resource settings, a lot, and I'll talk about particularly women, they have informal work. So they may sell crafts at a fair, or they may work in someone else's home. So all of a sudden now those jobs don't exist and money is not coming in, and you don't know when it'll be coming back in. So then it's the fear of your family and direct resources, but we saw a lot of food insecurity. Just like in the US, I mean, when we saw lines in the US of people lining up to get free food, and it was because of that interruption in your daily income or weekly income coming in, times a community of which is much less resources, that everyone sells their goods at the market every week. The markets are shut down, or if they are open, everyone's scared to go, and rightfully so, because you didn't know what was happening. So that major disruption led to other things like domestic violence and gender-based violence. We were seeing an uptick in those because, again, you have food insecurity, economic insecurity, stress all around. And when you don't have health centers or health workers who are meeting up with these women and children on a daily basis, primary health care, now you have no one looking out, no one reporting, no one saying, wait a second, I see something that I didn't see before. So that support system and that safety net disappeared for a lot of women and children. And that's where Pathfinder was, jumped into action also, and making sure with other organizations and with partners with the government that we were saying, wait a second, we have to make sure we get these services back up and running. We have to make sure that frontline health workers, and particularly those community health workers who know everyone in their community, were supplied with the PPE so that they could be out in front. And that's that protective gear that we all hear about. And that they were tracking families, getting them the resources up close and personal. And that doesn't even say anything about the pregnant women who are there, or those who are postpartum, which is, a lot of us on the line may know, like having a baby, you spend a lot of time while you're pregnant going to the doctor or the nurse or the midwife. And then right after, you spend a lot of time going back. So when you're interrupting those services, those conversations are missed. And again, even something like postpartum, it is those health workers who identify and help you through those times, or breastfeeding even. When you're missing that connection, it's hard.
Yes, absolutely. And so you mentioned that one of the things Pathfinder did was make sure that your staff had PPE, made sure that they were still able to see people, had the protective gear. But how have you still been able to do your work? How's it been impacted? What have you been able to do?
Absolutely. So one of the first things we really did was get with the government and said, hey, you need guidelines here. And that may seem really basic, because it's like, well, why would you worry about a guideline when you have a health crisis? But everyone has to know what they're supposed to do. And where do we change off resources? What's needed first? So something as simple as getting everyone together and really figuring out the strategy is really what this guideline piece is all about. So we worked with the governments on getting these guidelines in place, and also recognizing their resources, because one of the things that happened with COVID is a lot of resources were redirected to just COVID, but that meant primary healthcare services, including reproductive health, were left out and not getting what they needed. So we were able to work with governments to say, you still have to keep these services going. The other thing is we really focused a bit, particularly in Pakistan, on looking at that community level. And because, again, we're in that local community, we know those communities well, we're able to say, wait a second, we need to ensure that these people get services or the PPE first, and ensure that, things continue, assessments of where pregnant women were, and to ensure that we did follow up. The other big piece was the digital piece. So, cell phones are really widely used as a part of, healthcare and reminders. but also having a quick analysis of which services a lot of the community health workers were using, and to ensure that we did some messaging. And that again was done in our Pakistan program led by our phenomenal country director, Tavinda there, where she was able to help with those types of things. So these things kind of we take for granted here are like really life-saving tools to ensure things happen when you're further and further away from the health services in many low-income countries.
So that brings up some interesting points. One, Pathfinder, you can see trends because you do work in so many different countries. So that's really interesting. And are there any trends that you're seeing that you want people to know about?
Yeah, and some are good and some are unfortunately sad trends. We saw some of the good trends where we saw people really working together. Communities were looking out for one another, just like in the US. It was a really nice thing to see people looking out for neighbors, really helping, forming little, informal groups together to see how they could help. You have NGO partners who were immediately reaching out to the governments to say, how can we work together? You saw donors who were saying, hey, go ahead on with your resources and let's see how we can put more into doing Zoom meetings and conversations. I mean, you literally went from overnight of people meeting in person to saying, like, how is everyone going to get together and have these conversations? So that was some of the really positive things that happened immediately. And unfortunately, some of the bad pieces were that, we saw domestic violence, that trend across country, and it just was a stress that kept pushing. And unfortunately, we're seeing the numbers go up and up in many communities. Another thing, unfortunately, we saw were interruptions of birth control. And so that, pregnancies increased, unplanned pregnancies in particular increased. We will continue to follow the data in the countries where we were working around safe and healthy deliveries of pregnancies, because that's another thing, women is, saying like women get pregnant no matter what's happening in the world. So it is interesting to make sure that we're looking at those services and ensuring that the support was needed. Now, many women are lucky, don't have any problems or interruptions or problems in their pregnancy, but that's not true of all women. So, one of the things we wanted to make sure is that, where we saw problems, that we're able to help with those interventions and help the government, in particular in the countries we work with, those interventions. The only other thing that I would mention is that we did the economic challenges of, like I said, informal sectors of, sales and markets and those types of things. I think that one of the things that we saw as trends where some countries really at first shut everything down, like the US, we shut everything down. But we were able to work with them a bit on helping them, saying, how do you do this safely? So you saw some countries like in Nigeria where they had certain days a week that they would say, if you're going to go to the market, sell on these days, and then other days to kind of keep the crowds down. And then of course, the communications, we did a lot of communications campaigns across multiple countries and helping the countries do it around mask wearing and washing your hands and all these like things that are really basic and things that we saw right here in the US.
Can you talk a little bit about our connection to public health across the world? I think a lot of times when there's stuff happening here, we can ask the question, like, what's the importance of doing this work globally? Like, what's the importance of connecting our public health system across the world? And those are big questions, but can you give us some insight into that?
Yeah, and what's really interesting is I felt like, so for people like me who do this all the time, I'm like, this should be the biggest showing of how important it is for the world to work together on these issues. And so, WHO, or World Health Organization, is paramount to our existence in the world because there's someone who's looking at these things day in and day out. One of the things the US is really good at, we don't maybe always think about it, is we're really good at systems. Like the US has a system pretty much for everything. Now we could argue it's not perfect, but we are really good at systems building. And that is something that we've been able to help other countries build, systems around health, systems around tracking of disease prevention. Our Centers for Disease Control is literally the best in the world, but we've helped establish the African CDC, and other countries like Nigeria has their own national Center for Disease Control. So being a part of the global stage is really important because we are able to export our expertise and partner with other countries on tracking things. So why in the global scheme, why this matters. I visited Centers for Disease Control a couple of years ago. And one of my favorite stories I always tell people is you go into this big room and it's a map of the world and it has little lights up of different outbreaks. And you'll see like measles is yellow and, tuberculosis is blue. And then so I started looking like Italy because I think at the time I was like, oh, maybe we'll go to Italy next year and visit. And so you look at it, you're like, why is there so many measles outbreaks in Italy? Like, what don't we know? And what it is they're tracking trends around the world constantly through this global loop. So CDC in Atlanta is working with folks around the world to say, what are you seeing? We're seeing immunizations go down here. What's happening? Do we see an uptick here? These are all the things that are happening behind the scenes that many of us as average Americans just don't know about. And that's, really nice. I mean, it's nice to be able to be in a position where the system works, whether you know about it or not. But when the system doesn't work, like COVID happened here, is where you're all of a sudden, everyone's like, wait, what is going on? Like, is there outbreaks? How come nobody knew? Like, we do know there's going to be another, health crisis eventually. But the idea is that investing and giving funds and the U.S. being such a leader on foreign assistance to ensure that these platforms and these pillars are built and supported globally, that we're not doing it all, but we're contributing as a global leader to these things, it makes a difference. This is what those sustainable, resilient health systems are really all about. And it may sound very like buzzwordy, like health systems, but when the health system is broken or is, we feel the impact. And this was a perfect example of the rest of the world, having experienced things. Now we were a part of this and really we're all learning from this.
So with that, where is the system stressed right now in relation to reproductive health, rights, access, information around the world? Where's the system stressed? What are some of the challenges that we're seeing in, I don't even know which month we're in of COVID right now, to be honest, but what are some of the challenges that you're seeing right now?
Absolutely. I think the things we worry about the most, frankly, is the pivoting of funding. Like anything else, when, there's a fire, then all the resources go that direction. And I feel like that's what happened over the first couple of months of COVID internationally. But, groups like Pathfinder and the Global Financing Facility, UNFPA, have been really strong and loud with saying we cannot deviate services and funding that are meant for reproductive health and primary health care away from those things. We need to have both things going at the same time, have emergency response, but also recognize how important it is to keep that investment going for a couple of reasons. One is we've been making some major strides in reducing maternal mortality, infant mortality, child survival, and access to reproductive health around the world. We do not want those things interrupted or going backwards. It is literally the human rights issue for me. But the other thing to really think about is those primary healthcare services are what people need every day. So if you're thinking about like what's primary healthcare in your own life, well, getting that flu shot, and going to the health clinic to do it, getting your birth control pills or getting condoms. Imagine if you couldn't do those things for months on end, what that would feel like in the US. Well, imagine that for, women around the world. So we have to ensure that those things are continued. And I think really being vigilant and hearing our leadership, hearing how important it is to continue to, focus on those primary healthcare services, including reproductive health and family planning, particularly with our women and our youth. Youth don't stop being youth just because COVID is happening. We see that again in our own country and on TV every day. It's one of those things. It's like, you're young, you're wonderful, you're invincible. But at the same time, like, a young person really still needs to go into the clinic and get tested for COVID. We need to make sure that while they're getting tested for COVID, they're also using a condom or birth control access and all these other things that we've invested so much energy in doing. We need to make sure those combined forces versus an either or. So just, ensuring that supply chain resources are not missed due to funding, due to access, and supporting countries where they need it. And like I said, the U.S. is just known for their leadership in global health around the world. I really want to see that continue and in a positive way. The World Health Organization, we help build that. We help, fund that. It is paramount to continuing to be a strong leader in the world to support the World Health Organization.
And I feel like I have to ask this then, as we're talking about health systems here and how our health systems impact the world, how important is the election for the work that Pathfinder does then?
Yeah, it is paramount. Really is. So I'll say to everyone, vote, vote early, have a voting plan. It is so important that we support leaders who support being a good global leader and support, universal access to sexual and reproductive health, period. It just is what it is. The rest of the world is on board with these things, our European partners, Canada. These are just important issues for us to think about, but they also are life-saving issues for us to think about. And so the election is important, not just who's at the top of the ticket, the president, but our Congress. Our Congress allocates funding. Our Congress, they talk about the policies, they implement the policies. It is important for us to have leadership at all levels who really support, frankly, women and youth in their health. And for Pathfinder, this is just, what we do every single day around the world, what we believe in. It is at the core of why we were founded. And so we we love, supporters like you, like many of us, folks around the world. We love that you continue this work and supporting Pathfinder to continue to do this work, but we really need you to vote and vote on these issues in particular and be vocal about these issues.
So voting is obviously one thing people can do, and I want to make sure we touch base on what people can do to help out. But if anyone has any questions, you're more than welcome to put them in the chat. I'm seeing that Craig has a question, and he said, the statistics seem to show poorer countries far less affected by COVID than richer countries. Why is this? Or is there a huge underreporting in the poorer countries?
So Craig, so think about first of all, great question. And the first I want to say is we never want we don't want any country to be suffering, period. We just don't want them to suffer from this. But just like in the US, it took a long time to get reporting under control, and we have much stronger systems. I would suspect, and global health experts are suspecting, that it's a lot of underreporting due to low testing and not, just not having access to the testing. But a lot of low-income countries were able to react faster than we were, because I think they saw what was happening in these higher resource countries and they were like, wait, we are not ready for that. So you saw shutdowns, bigger shutdowns happening a little faster in other countries than they happened here. They're still, having the same issues we're having with, people complying with wearing masks and all those things. But I believe a part of it is underreporting, but I believe, and due to low testing, but I also think some of it was they were able to learn from us the same way, our country started to learn from other countries on how to react.
There is another question that I'm seeing. I feel like I missed it come through. So Anissa, can you message it to me and I will read it out loud. Kristen was also asking about have you spoken about partnering with Zipline, the drone last mile delivery unicorn in Rwanda and Ghana? She's saying, from what I understand, they're spearheading SRH delivery to remote locations.
I don't know specifically about those particular partners, but I will say something about delivering at the last mile. Particularly we, in countries, Pathfinder takes the lead from the Ministry of Health. That is usually because, they usually have a plan and we help with the implementation of the plan. But I'm glad she brought up last mile. That last mile really is the most remote places to work in a country, and they usually are further and further away from health providers. So community health workers, those frontline health workers, those are the ones doing the service delivery out there. Rwanda is a little bit more unique because they, have fantastic roads that lead out through all the part of the country. That's not necessarily true of every country, but particularly that last mile can be particularly vulnerable. So again, you're talking about people who may be on a cycle of birth control who now, because the next person coming out doesn't come out for 3 months, no longer has it. So that the technology of drones and different things like that are being used, as well as, really getting more more workers out to those places because they know they're more vulnerable, and thinking about now 6 months supplies of resources. They also have like chests that people put out, and they'll put resources in there in the lock boxes almost. And then a community leader will have the key for those lock boxes. They're trying all sorts of things in different countries to ensure that there's less interruptions, but also least contact in those services too. Because remember, the testing isn't necessarily happening in all these places.
Mm-hmm. Right. There's another question. I think this is a good one around what experiences show about sexual reproductive health in the era of HIV and AIDS that give direction for today's COVID-19 response?
Yeah, so essentially, like, what did we learn? And I think a lot. I mean, one is that some of the leaders on the U.S. Government's team for COVID response are leaders from the HIV/AIDS community and had led those efforts. So I think the whole idea of this, of course, being more spreads easier, more easily than HIV due the contact. I think the whole idea of contact tracing very quickly, a lot of us heard about that, and contact tracing and using cell phones to do that and that technology to do it. I think also the AIDS response was a lot of agencies, particularly US agencies, working together, but tapping into agencies and different programs around the world. Some of the learning and the system set up from HIV were able to be tapped into for this. As far as access to reproductive health and access to HIV or ARV drugs for those who are HIV positive, I think both of those tracks went on the same way. Is how did we ensure, I remember a time after the earthquake in Haiti where you were thinking, how do we get those ARV? People are still HIV positive even during an earthquake. People are still pregnant during an earthquake. So those same systems, you were thinking about getting them through. And that's where a lot of that collaboration happens. And that's where those global connections really work. So having ministries of health be able to say, we can't get out to this area. What do we do? What systems do we have in place to take advantage of those things? And particularly with supply chain, we learned a lot about delivering HIV/AIDS drugs in countries in that supply chain, reproductive health care and services actually following some of those same supply chains. I think were really important and good lessons and learning from other things that had happened in countries before.
So we're getting close to time, but there are two more questions that I would love to hear you answer. One of them is, how do community members work with faith leaders and other influential members in the community to continue sexual and reproductive health services and funding without interruption during the pandemic?
Great question. So Pathfinder is really proud to work with the faith community, and that's all faith community in the country where we work, because it really will be very diverse. Like in Nigeria, you have, such a large country that has a diversity of, depending on where you're working, of what faith communities are most prominent. And so we've done a lot of work there. We're also a member of the Christian Coalitions for International Health, and we work with different faith organizations around the world to deliver on family planning services and to help with policies. Now, again, one of the things I really want to emphasize is we have local nationals who are running our programs, leading our programs, who are part of this. This is not a US prescribed, you should be using birth control because we think it's a great idea. This is really about working with local nationals who are planning, using the plan of their own government to put these things into place, and then being a good partner on the ground to help with delivering the services and making things happen. For us, we believe that regardless of what faith, when women want access to reproductive health services and they decided with their family on whichever services they want, we want to be there to support those things. So we do work with, West Africa, we work with the governments there a lot on safe services and delivery of services and, post-abortion care where appropriate. We really, are very adamant to support women's health and adolescent and youth health. And for us, reproductive health is just a part of that.
That's one of the things that I've always respected about Pathfinder is it's the continuum. It's like the continuum of care when it relates to women's health. And it's not going in and saying, here's the solution and here's what you need to be doing. It's looking and giving access to information first and foremost, because that's drastically lacking. And then also increasing access to certain solutions that we do know work well, and then exploring others as well. There's one more question from David. Could you shed a light on the impact of the results of the election globally in terms of the global gag rule?
Great question. So global gag rule, I think a lot of people may have heard of it, or Mexico City policies, the other word for it, where it basically tells U.S. organizations working in other countries that we cannot advocate, support, or you can't advocate for, support any organization delivering abortion services, even where it's legal in that country. So the reason why this is difficult is because, a lot of things get grouped, particularly in the current administration, got grouped into that, big basket. This has been going on with every Republican president elected since Ronald Reagan, and every Democratic president elected, essentially puts a stop to it. Now, it may seem like a political issue, like a football back and forth, but I think we all recognize on this call, these are people's lives. They're not footballs. This is not a game. This is about real people's lives. And so when services are interrupted, and meaning that health center does post-abortion care, it does abortions where it's legal, and all types of other services and family planning services, when all of a sudden now they don't get funding from an organization because they happen to deliver, abortion services among their other work, then that's an interruption in the work and the services there. And that may mean that woman who came there and says, well, last month we could do it because it was December, but January we have a new president who doesn't support it, now you can't do it. I mean, it really is a big problem. The Democratic president, and certainly has already been said, if Vice President Biden is elected president, he already voted, already committed to rescinding the global gag rule. Our hope, frankly, as an advocate for me, is for us to get a permanent repeal to the global gag rule. It is quite a privilege to sit in a country where it is currently legal, and you not have to rely on a political football whenever another country's president is elected. And so I just think that we want to put a stop to this back and forth. It's just not a game, and right now it's just become a political cartoon for people to say, okay, well the next president will change it. It's like, no, these are people's lives. Let's not do that. Let's make it a permanent repeal to that. So that's what advocates are doing. We hope that we see a strong president in office who supports reproductive health care. And like you said, that continuum of services and continuum of care is really what Pathfinder is all about.
Yeah. So then what can we do? Obviously voting. It's an election year. That's a big one. Voting. But what can we do to help out?
There are three things I'm going to give you. So perfect question. One is donate to Pathfinder. You can go right to our website and donate to pathfinder.org. And it's really important. You may say, well, my small donation won't make a difference. It really does. Every donation counts, just like every vote counts. Every donation counts. Also, we have a 3-question survey that you can do on your phones. If you text participate to 52236, and it's also in the chat, that would be great. And then finally, sign on to the sign-on letter to the candidates, both presidential candidates, to stop gender-based violence. And I can't emphasize enough how important those primary healthcare services. Many women in the U.S. recognize they go to the doctor to get, well woman checks, to get birth control and things. That's where your healthcare provider sees you. If they're seeing, marks, bruises, or they see you, not seeming the same, sad, that's where the interventions happen. When you're interrupting those services, those interventions don't happen. And that means that women are suffering in silence or suffering alone. And that's why it's so important to keep those services going. I mean, really, frankly, to save the lives of many women around the world.
Awesome. Thank you for having this conversation, for sharing. I think Anissa wanted to hop back on. And just to repeat, pathfinder.org/donate. The survey, 3 questions, I think you said, so we can text 52236 and participate. And then Anissa also posted in the chat a link so we can tell the next president.
Perfect.
Thank you.
Thank you.
Hi, everyone. Thank you all so much for joining. Thank you for staying late. Extra credit is wonderful. I am really, like I said, this is so important. And every time I talk to Crystal, like I get chills because she reminds me of how important it is. And the fact that lives are at stake is, it's not a joke. So if you can donate to Pathfinder, that would be wonderful. Taking the survey will probably take less than a minute of your time. So if you could just answer 3 quick questions, we would love that. Thank you to everyone who joined us. Thank you to the panelists. If you have any questions, feel free to email me, adin@pathfinder.org. And this will be available as a recording that I will send out. So enjoy the rest of your days. Thanks.
Thank you.
Thank you.